What if a person has multiple wounds? Which wound should you address first? People commonly think that you try to identify the more severe bleed, or whichever is closest to the heart. The simple answer is, the wound that you should address first is the wound that you can use a tourniquet for. Then, you should address other wounds that you have to pack or hold continuous pressure. It's much better to invest 30 seconds of bleeding while you place a tourniquet than it is to invest several minutes while you invest time packing a wound or commit yourself to holding continuous pressure. This does not mean that you have to ignore the other wounds while you place the tourniquet. If you can, use your knee to apply pressure to the second wound while you tend to the first. You may have heard of products called hemostatic gauze. This is gauze that's been impregnated with a material designed to help the body build a quicker, better clot. There is evidence that supports these products and that they can have some benefit in certain circumstances. At times, I've definitely recommended these items be available in hemorrhage control kits for organizations such as military units or SWAT teams, or at times certain first responder applications. However, there is also plenty of evidence that the most important aspect of hemorrhage control is technique. Well-aimed direct pressure, good deep wound packing with maintained good pressure using a pressure dressing is the key to hemorrhage control and saving a life. Additionally, based on the significant price difference between hemostatic gauzes and standard gauzes, I feel it's much more beneficial for someone to be able to place 10, 20, or even 100 rolls of simple gauze in numerous locations throughout their premises, as opposed to a few rolls of hemostatic gauze in a few places. If you do elect to use hemostatic gauze for your applications, I would strongly recommend, as we did with tourniquets, that you use a hemostatic gauze recommended and approved by the Committee on Tactical Combat Casualty Care. Some bleeding control kits may contain something called a chest seal. One of the most important things to remember about a chest seal is it is not a bleeding control device. Chest seals are intended to address certain kinds of very specific injuries to the torso that interfere with our body's ability to breathe. Their purpose is to reestablish the normal breathing mechanism in that particular kind of injury. But again, it has no purpose and no intent to attempt to stop bleeding. These are somewhat of a complicated device, as are the pathophysiology that leads to their need. For that reason, it's important that if you're going to use a chest seal, that you get extensive additional training in how to use these. And in most circumstances, these are probably best left to trained medical personnel. It's important to also remember that there are some circumstances where placing a chest seal on a wounded person could actually lead to worsening of their condition. So if a chest seal is placed, that patient must be monitored continuously. And if their condition begins to worsen, that chest seal should be immediately removed. Now, let's discuss hypothermia. As mentioned earlier, hypothermia is a killer of trauma patients and must be addressed early. You might associate hypothermia with the cold of winter, but hypothermia is a trauma patient's worst nightmare, and it can happen any time of the year, including in the heat of summer. In general, a person loses about 10% of their ability to create a blood clot and stop their own bleeding for every degree Celsius below normal body temperature. So, a person who has dropped 2 degrees of body temperature has actually lost 20% of their ability to produce a clot, which is compounded by the bleeding itself. So once the bleeding has been controlled, always act to prevent the patient from becoming hypothermic. If possible, keep the patient out of the elements. A disrobed patient who is dry is much safer than a clothed patient who is wet, because water transfers heat about 32 times faster than air. Cover the patient with dry clothing or a blanket or even an emergency blanket, as you see here.